welcome to Zurich and welcome to the Gustar practice.
Thank you so much. It's a pleasure to be here.
Why psychiatry? Why aren't you a lawyer or a finance person? What brought you into the field of psychiatry?
It's a really good question. I think my curiosity about people, I think actually my whole life I've always been very puzzled by people and the human condition, really. Just even as a child, noticing the way people behave, the way they act, oftentimes is at odds with what they say. And just trying to make meaning of the world around me. I think really just to feel safe, to form connections and relationship, which I think as a child is vital to feel safe, to feel in relationship. I pretty soon realized I had to listen very closely to the person's experience so I could enter into their world. So in some ways, confusion about the world around me and trying to enter into and feel safe was a way I navigated early life, listening people, hearing their stories, hearing their narratives. And actually, unbeknownst to me, that was the start of my psychiatric training, studying people.
Okay.
So as I got older, it was a natural fit.
Next week is Bicycle Day, I think, next Friday.
That's interesting, yes. Bicycle Day is a very prominent day in Switzerland. Perhaps you can share with people what the prominence is of that. I'm imagining in Switzerland it's a big deal.
I don't know if it's a big deal here, but it's definitely a big deal amongst the psychedelic community. Bicycle Day is the 19th of April, and it is the day that Dr. Albert Hofmann first took a very large dose of LSD, and without understanding how this would affect him, got on his bicycle and made the journey from his office to his home with a huge dose of psychedelics inside him. So it's really the first recorded LSD trip that ever happened on the planet.
And it happened in Switzerland.
And it happened in Basel, I think, yeah.
Exactly.
Yes. And how did you get introduced into this particular field of psychiatry?
Well, I've always been interested in not just diagnosis and treatment, which is what psychiatry has really in recent years become. You know, psychiatry tends to swing like a pendulum between the psychological approach versus the biological approach. And in recent years, really biological theories and methodologies have become the foreground. And sadly, they've really failed to be as effective as we would prefer. So I was trained as a psychiatrist, but I actually got very interested in psychoanalysis because that gets into what are the underpinnings of the symptoms that we all present with or patients present with in my office. What are their stories? What really are the underlying features that might lead to deeper plasticity or change within the human I'm working with, or even how can I use myself to help another person? So that was my background, was really looking at these underpinnings, and psychedelics really give us deeper access to the unconscious or to different layers of the self. I personally got introduced to them through colleagues. I have the good fortune of working with a lot of very experienced colleagues who were older. So they had the privilege of working with some of the founders in this field. One of my dear friends is also a psychoanalyst, an older gentleman who worked with Humphrey Osmond, a Canadian psychiatrist who coined the term psychedelics. And he was renowned for doing a lot of research with LSD and alcoholism. And the results were astounding. So he would tell me about how in those days you could write a letter to Sandoz and get a vial of LSD in the mail, shipped to do, and you could do your own research, which effectively for him involved just doing LSD with friends and collecting not very robust research, but some data anyway. And his stories blew my mind, actually, how useful it was, what he was seeing. And I really didn't think there was any possibility that in this day and age, that whole period of research or even clinical availability could come into effect. So it's been quite astounding how rapid it's become.
Conventional psychiatric medication is usually prescribed over a term. You know, maybe people take a medication every day. What about with psychedelics? Is it a one-off event, or are people taking a course of treatment? How does it work?
I would say it's both and, but usually it's a sequence. Usually most of the studies and most of the experience I've had is usually it's initiating a process, an opening, and you can really train people's minds and bodies to learn how to move out of fear and patterns of conditioning. Most of us live in a habitual conditioning, really the patterns that we've established in our early life, which we keep on employing, which is why we're recognizable to our families and friends. And that becomes, our safety zone, but also a little bit of a restriction in our everyday life. And a lot of our gifts are really limited because we're doing the same moves over and over again. And I think we see this in people. We tend to not be quite as expansive as children, as adults, right? We see how we become narrower, more restricted, more rigid, generally speaking. And we certainly notice the individuals who, as they get older, are still free and open and have new ideas. And psychedelics really allow us to open ourselves up, to move beyond those limiting structures, to harness more of our creativity and our imagination, and have more of a child's mind, of seeing things differently, not being so locked into perspectives.
I want to ask a question about the difference between somebody taking a psychedelic in a recreational setting and in a clinical setting. Like, are people that are taking psychedelics at raves, are they curing their own trauma?
It's a really interesting question, right? I think that, connecting socially can be very therapeutic. I think we know that when we're disconnected and lonely, oftentimes we can feel, less good, more suffering. Although I think that's a very tricky thing because there are a lot of people who feel tremendous disconnection and loneliness, even within communities or within families. So it's not so easy on the outside to gauge that. But of course, I think there is some bonding aspect that could be deemed valuable. And psychedelics in community, even in, research, which is, not done in labs, but just collected through reports, there does seem to be some value. Although I would say in general, even talking to, individuals I work with who use a lot of recreational drugs in college or at Burning Man, I'm not sure as a group I see them as mentally healthier or more enlightened. But, that doesn't mean to say there can't be some therapeutic value. Some of it depends on the intention, and some of it actually depends on, I think, the set and setting and the direction. I have worked with individuals who have used psychedelic drugs in party scenes and raves, and they're shocked when they come to my office because the experience, even if they're taking the same drug, is vastly different. Some of that, of course, is you never know what you're getting. When you're doing a recreational drug and you're getting it on the street, you don't know if you're actually getting the active substance.
Okay.
And some of it is also when you actually have to go into your own process. Individuals have noticed it's not just peace and love and having a good time, it's actually meeting yourself, which can be a very beautiful experience, but can also bring up a lot of feelings that haven't been processed, which are beautiful to have a situation to work through them, but can be a lot of work emotionally, because this is, after all, psychotherapy. And there is a benefit to that, but it's a deeply different process.
So, for example, there's ketamine, there's MDMA,
Correct.
There's LSD, there's psilocybin, several others.
Right.
Is the impact of all of these psychedelics similar, or are they very diverse in their end result?
It's a really good question. I would say, well, first of all, I think they're quite diverse, sometimes in the way in which they act in the body. The receptors they hit, MDMA works very differently than ketamine, which works very differently than LSD. They even work on different neuroreceptors in the brain. So their mechanism of action is very different. And then the experience itself can be vastly different with the different medicines. MDMA will allow people to feel very safe in a very heart-open space, less in their thinking mind, more in their emotional mind. And in that field of safety, they can really go into comfortably dark traumatic memories, which comes up almost spontaneously to be looked at, processed, and healed. So it's a very different experience during the MDMA session, which is quite long, lasts 3 to 6 hours. Right. And that's quite in contrast to something like LSD, which is a very long experience. It's 12 hours in duration, quite intense. It comes on at a peak and then it slowly, over the course of the remaining 11 hours, It's still quite persistent, sometimes in rolling waves, but it's a highly, highly activated state where you have a lot of sensory impressions, a lot of information coming from the inside and outside, visual distortions, a lot of knowledge coming through these different modes of experience. So sometimes people will learn about themselves through visual imagery seen around them, or when they close their eyes, or through different sensual realms, even like downloads of information through music, or through reflection, or through somatic experience. So it's quite, we call that synesthesia, where all of this mixing of different sensations, which is so different than ketamine, which is short-acting. It really only lasts about 40 minutes when you give it by injection. And during that duration, the experience is quite meditative, depending on the dose. It's called a dissociative. So it's a dissociative anesthetic, actually. But in the lower doses, you almost distill out the components of the self. You see the mind, you see the emotional stream, the somatic stream, and you have a platform to witness how you're built architecturally. So you can imagine the experience itself is quite different, and the downstream effects also can be quite different too. But I like to use the analogy, it's almost like you can learn about yourself or grow yourself through different experiences. Very much like, I think we all grow and learn about ourselves through travel to different countries. You can go to India and learn about yourself, or go to Europe and have a different experience of yourself. And for some people, I could see you, meet you, talk to you and say, no, you should don't go to India. You're going to be a bit freaked out. Why don't you start off and go to America first? And then from there, you'll learn about yourself. And so that's like how I like to think about medicines, because you can really have a sense based on the individual about what would be a nice way for them to explore themselves. Someone who's really traumatized and has a really difficult time being alone, to start with MDMA might be a good place, because that'll allow them to open into safety and not be disconnected. Whereas someone who's a bit of a controlling type, to stay safe, is very obsessive, that might be a start, but something even shorter acting, where they don't have to lose control for more than 20 to 40 minutes, like low-dose ketamine, might be a better starting point. So you can really become sophisticated and skilled in trying to assess. Sadly, at this moment, some of the choices are restricted by legality, because a lot of these medicines are only available during research protocols. But in the future, hopefully, we'll have more sophisticated ways of assessing why one drug might be preferable for a person versus another.
Dr. Gita, it's been fantastic talking to you today. You've got so much knowledge and experience, and I've really learned a lot. And thank you for spending some time with me and with the Gustar practice, and sharing your knowledge with us.
Thank you for having me. It's been a pleasure being here.